Kelly Lam here for Rebel News. Good old Twitter really seems to bring out the worst in people, doesn't it? For a recent example of this, we need only look to the case of a Saskatchewan University professor who recently doxed a Saskatoon citizen and former political candidate on the platform, which led to rather a flurry of conversation, as well as a broader discussion about medical privacy and ethics. So, just what did this teacher say to cause such a stir?
Warning, censorship. Warning, censorship.
Dr. Kyle Anderson, Assistant Professor of Biochemistry, Microbiology, and Immunology at the University of Saskatchewan, recently created a bit of a ruckus on social media. On October 6th, he wrote the following: "I want 0 Saskatchewan residents to die from COVID. Pro-vax, anti-vax, young or old, perfect health or numerous comorbidities. It's a gruesome way to suffer and die. My condolences to @MarkFriesen08, as I verified someone with his name at RUH." After some backlash and concerns in the responses, he continued: "Because people have asked, when your friend goes offline unexpectedly and you hear they're in the hospital, you can call the hospital up to ask where to send a gift basket. Unfortunately, they said I couldn't because it's a COVID ward. No insider knowledge, no HIPAA violation." HIPAA, by the way, is the Provincial Health Information Protection Act. Word got around to the Dean of the University of Saskatchewan's College of Medicine, Dr. Preston Smith, who put out a post on Twitter at 10:11 a.m. the next morning, October 7th, saying he was aggrieved by these actions and that this behavior is well below the level of integrity, professionalism, and judgment I expect of every member of our college. More on that in a moment. At 5:51 p.m. on October 7th, presumably after speaking with Dr. Smith, Anderson posted a typed letter which stated, "I write this note to correct erroneous information and assumptions circulating online. Yesterday, a detractor of COVID science and evidence-based policies was claimed by others to have been taken to hospital by ambulance on social media. Speculation online was that their absence from social media for several days was due to COVID. It is true that I contacted the hospital by phone and asked if I could send a token of my well wishes to them. I'm sure many sympathizers with their cause did the same. I was informed that nothing could be received by the hospital due to current COVID measures, but I was told I could call their room number, which I received." He went on to discuss how he has been vocal about maintaining civility in society, even against ideological opponents, and he wished Mark well in his recovery. He continued in his defense: "At no time was any diagnosis or condition divulged to me by SHA staff, by phone or otherwise. I also realize that many accuse me, cynically, of using this as an opportunity for an 'I told you so' moment." Anderson denied this and later that night added one last explanation to his Twitter timeline, admitting, "Sharing Mr. Friesen's personal health information without his permission was an egregious error in judgment, and I regret it. I sincerely apologize for any harm done by my actions to Mr. Friesen and his family. I am now taking a step back from social media to focus on the data." I reached out to Dr. Anderson for comment but did not receive a response. I also reached out to the Dean of Medicine, Dr. Preston Smith, and asked 2 questions: whether there would be any disciplinary action brought against Mr. Anderson, and what policies would be put in place to ensure that this never happens again, and that Saskatchewan citizens can feel confident in their medical privacy. Dr. Smith's assistant provided the following statement, which stems from a Twitter statement put out by the College of Medicine's Twitter account, stating, "I believe it is unethical for anyone to share private information about a patient receiving care without that person's permission. For physicians and others directly related in care, there is an even higher standard of conduct expected. As Dean of the College of Medicine, I hope that all members of our team would meet that ethical standard." And I shared that message by email to everyone in the college yesterday and on Twitter. The college and university are reviewing the matter now and will work within the requirements of our university policies and collective bargaining agreements as appropriate. However, we do not share private information related to our employees. The person whose private information was released is Mark Friesen, a 2-time candidate for the People's Party of Canada in the riding of Saskatoon Grasswoods, and someone you may recall from one of our older Fight the Fines cases. Friesen has been vocal about his concerns with everything from masks to lockdowns to vaccine passports, which has garnered him a lot of negative attention, both from the mainstream media and citizens alike. While we cannot confirm that Kyle Anderson and Mark are friends, as Kyle suggested in his original explanation, certainly a quick perusal of their timelines shows vastly different views on the COVID pandemic, most especially with regards to COVID mitigation strategies. While I know that only Mr. Anderson knows his impetus and his own heart, and while I don't want to be cynical, it seems unlikely to me, personally, that Mr. Anderson would have inquired about Mark Friesen's hospital status for compassionate reasons, especially since his story changed a bit between the original and how it evolved later on. What is clear, however, is that releasing the information about a patient's potential hospitalization is unethical, harmful, and quite frankly, disgusting behavior, if you ask me, and also according to the Dean of Medicine himself. I truly hope that Kyle Anderson's apology was sincere. I believe that people can change if they want to learn and grow. But most importantly, I hope this situation serves as a warning to others who might try to partake in this appalling behavior in future. As for Mark Friesen, we will maintain our journalistic ethical standard of respecting his medical privacy. We will only say that we wish him and his family well, and we hope that this egregious breach of his privacy does not cause him any harm, physically or psychologically. Yes, we live in divided times. We often have different opinions on COVID, vaccines, masks, and other topics. But never is it ever okay to divulge someone's private medical information, no matter how much you might dislike their message. Ethics policies are created for situations just like this, to prevent people's feelings from getting in the way of basic standards and ensure that human bias stays out of such decisions. A standard that is bare minimum in a democratic civil society. Let's all try to be better, Saskatchewan residents and beyond. If nothing else, follow that old but sage wisdom of the golden rule. Treat others how you want to be treated. To help us with our legal battle against vaccine passports, please visit fightvaccinepassports.com.